Good morning, fellow Rotarians and friends. Magandang umaga po sa inyong lahat. Maayong buntag kaninyong tanan. Welcome to the virtual town hall launching of the Philippine Rotary Vaccination Campaign. To formally open our program, let us welcome our National Chairman from the Rotary Club of Makati West, past Rotary International Director Guiller, Tumangan.
Good morning, distinguished dignitaries, fellow Rotarians and guests. It gives me great pleasure to call the virtual town hall launching of the Philippine Rotary Vaccination Campaign to order. President Holger, and past RA President and TRF Chair Ravi, as forming governors who are now in the thick of their busy conferences, pacemaker governors who are in full swing with the preparatory training of officers, and my classmate, past RA Director Robert Hall, Vice Chair of RI and Polio Now Committee. The task force is very grateful to all of you for giving this challenge your keen and caring attention. How will I describe what I'm feeling today? We are all expectant mothers and fathers in the last trimester, looking forward to the birth of a big bundle of joy, a baby sister to elder brother polio. Because of the coronavirus, the world became one huge neighborhood. This is an opportunity to give life to Paul Harris' vision of a neighborly world. Arians will be engaged at different levels of influence in little acts of kindness and with one voice to beat COVID-19. Our timing for the launch is perfect because April 24 to 30 is Rotary's World Immunization Week. Rotary clubs across the globe will come forward together to promote the power of vaccine. As we listen to our Rotary leaders and resource person this morning, let us individually revisit our experience with vaccine. How many vaccines have you had since the birth up to today? Same question goes for your kids and grandchildren. Since the first polio National Immunization Day in 1979 was launched here in the Philippines, how many millions of children were saved because of polio vaccines? How much have you and your club contributed to the Polio Plus Fund? Where are we today? Can we achieve the same success with the coronavirus? Today's town hall hopefully will lead to an informed decision. Of course, a decision that is commitment, concerted effort. First, may this town hall, ambitious as it may seem, achieve a consensus on why vaccinate. Second, in one voice, let us convey one message of hope. A set of hope for a COVID-free world. And third, one opportunity may all clubs implement a whole of Rotary approach to disease prevention and treatment. By each district governor, past, present, and future, galvanize his or her team of presidents to be advocates of vaccination for a COVID-free Philippines in the shortest possible time. Together, as people of action, we shall act with a renewed sense of urgency for herd immunity, resiliency, and socio-economic vitality. Today, one Philippine Rotary opens opportunity to lead, innovate, communicate the Rotarians' love of neighbor so that we heal as one family. As Rotarian, we walk the talk and we lead by example. I am very pleased to share with all of you that last Thursday, my spouse Letty and I got our first dose of vaccine. May bukas sa bakuna, together by God's grace, sa awa ng Diyos, we shall overcome the coronavirus. Our unity will be our crowning glory. Maraming salamat. Mabuhay tayo lahat. Thank you. Thank you very much. Please allow me now to turn over the control of the proceedings to our Master of Ceremonies, as District Governor Sunny Coloma.
Thank you, Director Tumangan, for your uplifting message. Our opening prayer will be led by the District Governor nominee of District 3830, Mildred Bitangkol of the Rotary Club of Makati, Actam.
Good morning, everyone. Let us all place ourselves in the holy presence of the Lord. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. In the spirit of love and compassion, let us pray. Spirit of life, God of many names, be in our hearts and minds as we come together today to pray for our world. We come today as people of privilege, grateful for this blessing and hopeful for our future. Bless the people in this gathering as we initiate a Philippine Rotary Vaccination campaign to help fight this dreaded virus that has claimed numerous lives of loved ones and friends. Our own tradition comes today the lifting of our spirits in unity, knowing that we are part of an interconnected web of life. We acknowledge and embrace our oneness. We will be the good we want to see in others. We will be the change that we seek as we implement our goals with a great belief in our hearts that we will succeed. We say, Amen.
Thank you, District Governor nominee Mildred Vitangcol. With respect, let us now pay homage and attention to the national anthems of the Federal Republic of Germany, the Democratic Socialist Republic of Sri Lanka, and the Republic of the Philippines.
Deutschland, Deutschland, über alles in der Welt. Denn es steht zu Schutz und Tote, brüderlich zusammenhält. Von der Mars bis an die Nebel, von der Esch bis an den Fels. Deutschland, Deutschland, über alles in der Welt. Deutschland, Deutschland, über alles in der Welt. Deutsche Frauen, deutsche Treue, deutsche Wein und deutscher Sang sollen in der Welt behalten ihren alten, schönen Klang. Uns zu ihrer Tat begeistern, unser ganzes Leben lang. Deutsche Frauen, deutsche Treue, deutscher Wein und deutscher Sang. Deutsche Frauen, deutsche Treue, deutscher Wein und deutscher Sang. Einigkeit und Recht und Freiheit für das deutsche Vaterland. Danach lasst uns alle streben, brüderlich mit Herz und Hand. Einigkeit und Recht und Freiheit sind des Glückes Unterpfand. Im Ganze dieses Glückes blühe deutsches Vaterland. Im Ganze dieses Glückes blühe deutsches Vaterland. Sri Lanka Mata, Abba Sri Lanka, Namo 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 Mata. Sundara Sri Bharini, Surani Ati Somarmana Lanka. Ranya Dana Nekamal Malaturu Jaya Bhumi Ranya. Sri Lanka. Namo, 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 namo Mata.
Bayang magiliw, perlas ng silanganan, alab ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupig, di ka pasisigil, sa dagat at bundok, sa simoy at sa langit mong bugha. May dilaghang tula at awit sa paglayang minamahal, ang kislap ng watawat mo'y tagumpay na nagniningning. Ang bituin at araw na kailan pa may di magdidilim. Lupa ng araw ng luwalhati, pagsinta ko'y langit sa piling mo. Aming ligaya ng pag may mga api, ang mamatay lang dahil sa'yo.
Welcome once again to all of our participants of this virtual town hall. Welcome to all Rotarians from Luzon, Visayas, and Mindanao. Welcome too to our Rotarians from overseas. With us today are the leaders of Philippine Rotary, the incumbent governors of all 10 districts, our incoming governors who will serve starting on July 1st, and our district governor nominees who will serve starting in July 2022. Also with us is the chairman of the Philippine College of Rotary Governors, Joe J. Jude Doctora, and the members of our college. They are the co-conveners of the Philippine Rotary Vaccination Campaign. Our national campaign follows the mandate of Rotary International. We will now hear the message of the President of Rotary International from the Rotary Club of Herzogtum Lomberg, Germany, President Holger Knaack.
Dear friends, we are living now for more than 1 year with the coronavirus, and unfortunately, the numbers of cases are still increasing. Everyone fears that new variants will emerge that could be more infectious, lethal, or capable . And that means vaccinated nearly every person on Earth. Rotary in the Philippines have a special relationship when it comes to vaccinations. It was in your country in 1979 where Rotary's first major campaign to vaccinate against polio began. And so, as we assist another effort to vaccinate the world and defeat a virus, we are counting on your continued success. Rotarians across the world have a role to play in supporting this global effort. Right now, many of the richer nations in the world are gathering as many doses as possible. And I'm encouraging my fellow Rotarians to advocate for fair global distribution of vaccines. Rotary International is supporting COVAX in its efforts to expand global access to safe and effective vaccines. And we must all work hard to educate people and to fight vaccine hesitancy as well. We need to support the safety of vaccines and challenge fake news and rumors that spread in social media. Rotarians know that vaccines work, and we must continue to advocate just as forcefully for COVID vaccines as we do for polio once. There is one more way that we can help cope with this continuing pandemic. We need to place a special focus on fellowship. These are difficult and demanding times for all of us. We are all feeling exhaustion and fatigue, and so we need to make a special effort to take care of one another. This is always an important part of being in the family of Rotary, but it's more important now than ever. Club members need to use their skills and help friends in Rotary survive and thrive in these times. We need to look after one another and use whatever resources we have to help each other, make it through this crisis intact. This spirit of caring is so important now, and it will help us shape our future. The care we show today will make our clubs stronger, and strong clubs will provide greater support to communities. When the crisis has passed, people will remember those who helped cope and survive. All the care we show each other will pay off in a stronger Rotary in the future. You have made that same kind of investment in the future through this vaccination campaign, and I congratulate you for launching it. This initiative will help the Philippines emerge from the pandemic faster and will shine a bright light on the good work of Rotary. For Rotarians, troubled times are a time for inspiration. Together, we will bring hope to the less fortunate, and we will demonstrate once again that Rotary opens opportunity. Congratulations to Rotary Philippines National Vaccination Campaign, and thank you.
Thank you, President Holger. That was truly an inspiring message. We just received a call from Colombo, Sri Lanka, from our TRF Trustee Chair, past President Ravindran, and his message is he's joining us at around 11 later on. So we proceed to our main event, our interactive town hall meeting. To lead us in today's dialogue on why it is important for Filipinos to get vaccinated, we have invited three eminent resource persons: Dr. Esperanza Cabral, Dr. Gerardo Legaspi, and Dr. Marilen Balolong. Our main presenter has served in the cabinet as Secretary of Health and as Secretary of Social Welfare and Development. She is a cardiologist and clinical pharmacologist. Clinical pharmacology is the study of drugs in humans, from the discovery of new target molecules to the effects of drug usage in whole populations. They participate in experimental studies, such as clinical trials for new vaccines, and investigate adverse reactions and interactions. She graduated from medical school at the University of the Philippines, Manila. She extended her medical and pharmacological training at the UP Philippine General Hospital, Harvard Medical School, Massachusetts General Hospital, and the Joslin Clinic in Boston, Massachusetts. I am pleased to introduce our main presenter, Dr. Esperanza Cabral. Welcome to our town hall, Dr. Cabral.
In the public health system, what is the playbook for trust building? In particular, we will be addressing the vaccine confidence gap, where it is associated with low levels of public trust in the wider healthcare system. Next, please. What is driving distrust in the public health system? I thought of three, and those all begin with D. They are disinformation, deficiencies, and desperation. You can probably think of more. Next, please. So, what is the playbook for building trust in the public health system? Okay, it will be fighting disinformation, correcting deficiencies, and giving hope. I'm sure you can think of more. Can you hear me?
Yes,
Yes,
go ahead.
Doctora.
Okay, so our focus this morning is vaccines. Next, please. And why are they important? Well, vaccines are important because they prevent severe disease and death. They prevent symptomatic disease. They prevent the transmission of disease. And they will enable us to reopen our economy. If you look at the top 10 medical advances in history, you will see that vaccine was the very first of them. That was more than 200 years ago. And since then, we have had other medical advances, such as the development of anesthetics, the theory of how we are infected, which is the germ theory, and so forth. Many years later, in our century, next please, it is still one of the 10 great public health achievements, second only to reductions in child mortality and coming before access to safe water and sanitation, malaria prevention and control, prevention and control of HIV/AIDS, tuberculosis control, and so forth. Next, please. Here is an illustration of the proof of the good that vaccines do. The circles that you see represent the number of reported cases of certain diseases, and the yellow circles represent the time when vaccines were developed and started to be used for these particular diseases. Our biggest example is measles, and you can see that before the development of measles vaccines, hundreds of thousands of children developed this particular illness, and tens of thousands of them died of it. But after the development of the measles vaccine, the incidence of measles came down sharply. There were outbreaks, and these were the fault of countries who did not completely vaccinate individuals. But in our present times, there are very few cases of measles, except in countries such as the Philippines. Next, please. If we relate that to COVID-19, we can see the experience of Israel as far as vaccination is concerned. The red line in the graph represents the incidence of COVID-19 among people older than 60 in Israel. They are the very first to be vaccinated in that country. And the blue line represents the incidence of COVID-19 among those less than 60 who were not given vaccines at this time. Vaccination started sometime in December, and COVID-19 incidents continued to rise until sometime in January. And at that time, COVID vaccine was found to be 98.9% effective at preventing death and hospitalizations. COVID-19 infections declined 95.8% among people who received both shots of vaccine, and COVID vaccine was 98% effective in preventing infections manifested by fever or breathing problems. Next, please. So we see that vaccines are important, and we wish that vaccines will come to the country sooner rather than later because of the rising cases and deaths from COVID-19 in our country, as illustrated in these two graphs. Next, please. As of 2 days ago, 11,429 new cases of COVID-19 were reported, and more than 140 deaths were reported. So we are really in a vicious surge of the disease, and we need to get out of this. Next, please. With our poor performance at testing, tracing, isolating, and treating, it looks like our only way out of this pandemic is to vaccinate ourselves into herd immunity. The question is, will we be able to do that in time? Next, please. So now we go to addressing vaccine confidence, where it is associated with low levels of public trust in the wider healthcare system. Next, please. If we look at vaccine confidence in the country, sometime in 2015, a survey was conducted, and at that time, 93% of us said that vaccines are important. 82% said vaccines are safe, and 82% said vaccines are effective. But in 2016, something happened, and that is the dengue vaccine scandal. And this affected vaccine confidence in the country, such that in 2018, when the same survey was conducted, 32% of people now thought that vaccines are important. Only 21% thought vaccines are safe, and only 22% thought vaccines are effective. So we have a huge problem with vaccine hesitancy in the country. Next, please. These are illustrated in the various surveys conducted sometime in 2020 and up to 2021 on the willingness of individuals in the country to be vaccinated for COVID-19. Sometime in the end of November to the beginning of December last year, Pulse Asia conducted a study, and 32% were willing to be vaccinated with the COVID vaccine. A few weeks later, another group, the Octa Research Group, did its own survey in NCR, and only 25% were willing to be vaccinated. And about a couple of months later, Pulse Asia did the same survey, and this time only 16% were willing to be vaccinated. So the vaccine hesitancy seems to be increasing as far as COVID-19 is concerned. Next, please. In the latest Pulse Asia survey, which was a face-to-face interview of 2,400 Filipinos aged 18 years old and above, conducted from the end of February to the beginning of March, these were the findings. And we can learn some things from this if we want to engage people and reduce their vaccine hesitancy and improve confidence in the COVID vaccines. Next, please. Nearly everybody is worried about contracting COVID-19. The graph shows that the table shows that 94% of Filipinos were worried to some extent or another about contracting COVID-19. Next, please. But even so, when asked whether they will get vaccinated if a vaccine against COVID-19 becomes available, only 16% said yes. 61% said no, they will not get vaccinated. And 23% could not say whether they would get vaccinated or not. Next, please. Next, okay. The primary reason why they were not going to get vaccinated was they were not sure of the safety of the COVID-19 vaccines. 7%, that's 84%, and 7% said vaccines might not be effective. Next, please. People were actually aware of vaccines and where they came from. But as you see, the trust in the vaccines is rather small. Although the trust in the vaccines coming from the United States of America was the highest at 44%, followed by Russia and Great Britain at 25 and 22% respectively. And the least trusted of the vaccines were the ones coming from China. This, of course, does not translate, next please, into whether they were favorable of the vaccines and will choose to get it for themselves. Okay, here it says that the most number of people will take the Pfizer vaccine, followed by Chinese vaccine Sinovac. I guess this means that they were more aware of these vaccines and of their being available or about to be available in the country. Next, please. So there is such a large hesitancy to getting COVID-19 vaccine in the country. So what is our playbook for building trust in vaccines? Well, as we said, the playbook includes fighting disinformation. And in particular, in the case of vaccines, we need to fight disinformation on Dengvaxia and the COVID vaccines. Next, please. This is what the anti-vaxxers say about dengue vaccines and COVID vaccines. Previously and up to now, they say that dengue kills, but Dengvaxia, which is the vaccine against dengue, kills more. This is totally unproven. None of the 100 children or so that the public attorney's office autopsied after their deaths were shown to be due to Dengvaxia. They also claimed that Sanofi paid the scientists and the FDA to certify that Dengvaxia is safe and effective. So apart from destroying the reputation of the dengue vaccine, the anti-vaxxers also want to destroy the reputation of scientists and our own regulatory agency, the Food and Drug Administration. They say the same thing about COVID-19 vaccines. They say, in fact, that COVID is not dangerous, and even if we catch it, it's okay. They say that, on the other hand, COVID vaccines are dangerous, and that doctors, scientists, and public health experts are not to be trusted. Next, please. They also have very myths that they propagate about COVID-19 vaccines, such as that the mRNA vaccines like those of Pfizer and Moderna, can alter human DNA. They say that the vaccines contain microchips that can be used for surveillance. They say that COVID-19 vaccines cause infertility. They say that the vaccine developed by Oxford University will turn people into monkeys. And they say that COVID-19 vaccines contain aborted human fetal tissue. None of this is true. Everything is absolutely false. And these are some of the things that you are going to have to deal with when you tell people or encourage them to get their vaccinations. Next, please. The next thing in the playbook for building trust in vaccines is correcting deficiencies. And here, we focus on deficiencies in government health services provided to the people. Next, please. Our testing, tracing, isolating, and treating programs for COVID-19 leave much to be desired. And so do the social protection and assistance to individuals affected by the pandemic that the government provides. And now we are seeing that the vaccination program that is being conducted by our government needs a lot of help, particularly from the private sector in the country. People such as yourselves in Rotary. Next, please. Finally, even as we fight disinformation about the COVID vaccine, and even as we try to help in correcting deficiencies in the provision of health services and social assistance, we need to give hope. We need to make them know, all the people in the country, that we can get out of this by working together, by following health protocols, and by getting vaccinated. Next, please. We do this by communication and community engagement. And all of us who want to encourage people will have to develop and align messages and platforms across public and private sectors. We will need to ask multiple champions and influencers to help us, chief of whom are the healthcare workers, who are the most trusted individuals in the country today. And we need to engage the community, perhaps through town halls and assemblies. Next, please. We know that healthcare providers positively influence a person's decision to be vaccinated, and that many hesitant persons agree to vaccinate if they engage in discussions with their providers. So this is something that we must encourage, in the same way that we must encourage all other people who can influence their neighbors and their communities to engage them in discussions about getting vaccinated. Our last resort will be mandatory vaccination with only medical exemptions. And we hope that we are not going to get to that particular point. Next, please. We also need to keep in mind that web-based interventions that educate people about vaccines have not been found to be very effective these days, and that social media campaigns tend to reinforce already held positions. In the past, epidemics of vaccine-preventable diseases used to help increase vaccine acceptance, but this has not been seen in recent outbreaks, such as the COVID-19 pandemic. Next, please. We need to give hope, and at least we can tell them what they can do once they have been fully vaccinated. We can tell them that they can visit indoors without a mask with other fully vaccinated people. So everybody must get vaccinated so that they can interact without masks and face shields at that time. We can visit indoors without a mask with a household or group of unvaccinated people who are not at risk for severe disease. We can travel domestically without a pre or post travel test. We can travel domestically or internationally without quarantining after travel. And we can travel internationally without a pre or post test depending on destination. Next, please. The final two slides are the most important messages that we can give to those we want to encourage to get the COVID vaccine. We should tell them that the best vaccine is the one available to us when our turn to be vaccinated comes. And finally, until we reach herd immunity, until all of us have been vaccinated, we really need to wear our face mask and face shield consistently and correctly. We need to keep our social distance. We need to wash or sanitize our hands frequently. We need to stay away from crowded places. And we need to stay home unless absolutely necessary. Thank you very much for listening and keep safe, everyone. Thank you.
Thank you.
Thank you very much, Dr. Cabral, for your highly enlightening presentation. I am certain many of our town hall participants are now more confident about getting themselves vaccinated. Our first panelist is the director of the country's top tertiary hospital. He was the first health worker to be officially vaccinated as the Philippines launched its vaccine drive last March 1st. As director of the Philippine General Hospital, he spearheaded the conversion of 6 sections and the retrofitting of 2 wards, including an initial 130 beds with ICU units within a record time of 1 week after the declaration of enhanced community quarantine in March last year. The PGH is now a model medical center, a haven where the treatment of COVID-19 patients is effective and organized, while most importantly, our healthcare frontliners can work safely. Let us welcome Dr. Gerardo Gap Legaspi.
Very much. Thank you for the kind invitation this morning, and I'm really honored to be here with you. If I may be allowed to share my slides. Okay. So this morning, I think it will be difficult to top the lecture of my mentor and professor, Dr. SP Cabral, but hopefully I'll just share with you some on-the-ground experiences that we might be able to use in our drive to convince people on to get vaccinated. And I'd like to borrow Mayor Isko Dumagoso's program that he called Creating the Vaccine Nation. It's quite catchy, that's why I wanted to use it for this morning. I think as all drives and all programs, we try to start with the right message. And early on, even before any vaccine was going to come, we started our deployment team in January 11 and sent out a message 1 week later that on the day that the vaccines come, we take any vaccine that is approved by the FDA and we deem it safe and efficacious. And just to drive the point even further of being committed to take that vaccine, I volunteered to be the first one in PGH to take it, whatever brand it was. So after that announcement, we did a confidence survey, and we were surprised and happy to see that there was initial acceptance of 75% of our healthcare workers not even knowing what vaccine was coming. It was even better when the government announced that Pfizer was going to be the Pfizer vaccine was going to be given to healthcare workers, and it jumped to overall 83% acceptance. And of the 5,400 who registered to have the vaccine, 94% agreed to have it to get vaccinated. There were some that deferred after that initial registration. So we went into our vaccination plans with very high confidence and very satisfied with the participation of our healthcare workers, only to have an announcement, whether officially or unofficially, that it was going to be CoronaVac or the Sinovac type that will be given to the healthcare workers rather than Pfizer. So I think you know the uproar on social media and the mainstream media against the decision of PGH administration to take whatever vaccine comes first, as we have already stated in our initial commitment. But still, we had to manage this, and we did a survey after that was released, and we're glad to see that still 75% are willing to take a vaccine, but only 8% of those willing to take the vaccine were willing to take CoronaVac. So we took this, we accepted this as the decision of our healthcare workers, and we prepared for a vaccination and expected not too many people to come, such that for us to really thresh out the issues, we tried for one more time to enlighten ourselves and the people of PGH by gathering everyone to a town hall meeting. We had 1,200 participants, almost 1,500, including those on Facebook Live, and we were able to answer questions and clarify the voluntary nature of this Sinovac vaccination and the possible arrival of AstraZeneca a week or two later. So after that town hall meeting, we deemed it quite successful because we were able to increase, not so much, but still there was a positive impact on the acceptance of the vaccine, Sinovac, with an increase of around from 8 to 12% acceptance of those willing to take a vaccine. So we prepared well for our vaccination. For those of you who haven't been to PGH, this is our small garden that we hold a lot of our activities. And we were surprised to see more people than we expected on that day. So I guess the biggest message that we can send to people is that if you're really bent on having a vaccine and committing to ourselves to taking in the first one that comes, we have to have ourselves vaccinated. I realize, my household, my house help, none of them wanted to get vaccinated at the start. But of course, when you want them to get vaccinated, you have to show them that you're willing to take the vaccine that they're taking also. So don't wait for your choice of vaccine if you're trying to convince other people to take what is available now. So we were surprisingly happy, glad to see a lot of our colleagues coming in first. No? Dr. Domingo from FDA, Dr. Mingita Padilla from the Santa Lucia Eye Center, of course, our scientist, Dr. Edsel Salvania, and Dr. Mike T, our Vice Chancellor. So I think the message was even sent better when all the top administration of UP Health Sciences Center in Manila had themselves vaccinated with Sinovac. That's our Dean, our Chancellor, Dr. Padilla, our Dean, Dr. Charlotte Chong, and myself, taking it on the first few days of the vaccination. So what did this do for us? From an expected 50 people on the first day, we had a deluge of vaccinees in the succeeding days, such that we were able to eventually vaccinate 1,925 of expected 300 people. So I guess the mere fact that people saw everyone getting vaccinated with whatever vaccine was available drove home a point and convinced some of them. Although, of course, eventually people with preferred AstraZeneca, who preferred AstraZeneca, waited for the next week when it was given. Just to give you an idea also, and even with healthcare workers, and how difficult it is to vaccinate some of our personnel, I think we have to do a better drive information campaign on our lower rank staff, especially in our experience, the maintenance staff had the lowest participation in our vaccination program. So I think we have to get stars, movie stars or TV stars or public figures to convince. I think doctors have less convincing power than these public figures that they probably will love to see get vaccinated. So in the end, we were able to vaccinate 32% of our healthcare workers with Sinovac. And that's a big improvement from the initial 12% that we had. So I guess delivering the message and delivering it with commitment and delivering it with personal participation is the most effective. Dr. Cabral has mentioned that maybe social media campaign does not really work. I think actual presence in vaccinations and to deliver the message of trust and confidence will be the most effective. As an aside, I was really very happy to have our most senior doctors get vaccinated, and I felt a feeling of self achievement with the feeling that I was able to protect our professors who mentored us and those who served PGH for a long time. Dr. Dick Chonko, a general surgeon, was the oldest vaccinated with AstraZeneca during the whole campaign. I think messaging is important, information campaign is important, and giving the right answer, although of course, is equally important. And I think one of the most frequently asked questions to any of us is, what's the best vaccine? And for now, we always say whatever is available. So what will be available, what is now available for us are Sinovac and AstraZeneca, but pretty soon with the giving of the EUAs for Gamaleya and Pfizer, hopefully they come in soon, and the others that have applied already will be in the pipeline. So as we have shown, we took in whatever was here, Sinovac initially, and now AstraZeneca. And I think the pitfall here is trying to compare this. I really am not in agreement with the statements of experts ranking vaccines from best to worst, because it really doesn't serve anyone any purpose to do that. And besides, if you look at the reporting of efficacy and of these vaccines, I don't think they can be compared apple to apple, because just an example, when Pfizer did its study and Pfizer and Moderna did their studies in America, the level of the virus transmission is quite low. I mean, relatively low at that time. When Johnson & Johnson did their study to confirm the efficacy, they were in the middle of a surge. So if you look at the reports that they had, you can see the great disparity of efficacy, leading you to conclude that maybe Pfizer is really much better than Johnson & Johnson. So I think before we make any, before we accept any of those conclusions, let us ask the experts on what they believe in. This data are all available online, but I think we should let experts explain to us how to interpret this data. The bottom line is, the vaccine that we choose is the one that protects us against a severe disease and mortality. And I guess for a lot of us in the going to the older age group, it should be the most efficacious also for those above 60. And if possible, with the ability to reduce transmissibility of the SARS-CoV. No vaccine now has sterilizing effect yet on the transmission. But of course, in the eventual herd immunity that we achieve with more people getting vaccinated will definitely lead to the reduced transmissibility. That's why we still are cautioned, even if we have the vaccine, to take the precautions, the health protocols, because we can still transmit the virus unknowingly in most times. So the bottom line is we get the best vaccine. The best vaccine is the one that we get in our arms, and the vaccine that prevents severe COVID conditions that might mostly in this particular surge, how we have learned to lead to a higher death rate. So other question is efficacy and effectivity. I think the bottom line of all the vaccines that we're getting is how effective it is in the real world. People, companies can report the best efficacy because they are carried out in controlled conditions in ideal settings. But I think in the real world, we have to wait because we have to see how it really affects clinical outcomes in various conditions, in different countries, in different races. And this is the real world data that we need to wait for before we can even make any decision. So the data, however, is quite difficult to collate also and to maybe make conclusions, definite conclusions very early on because most of them are observational. So it is too early to decide now on which vaccine is the best because data is changing. Just this morning, we saw that Pfizer is thinking of a booster dose already for the two that they have given the population in America. So I guess we really need to wait for data. But as Winnie Monsoda said in her column this morning, just get the one that comes now because in her estimate, if she takes Sinovac now, it will protect her for 3 months before she actually could get her preferred vaccine. So in those 3 months, a lot of things can happen. Actually, in one lunch, you can get the infection from someone from the rest of your family. So that driving home the point, I think aside from the benefits that were already discussed, I think the biggest benefit, one of the benefits that we get also from being vaccinated is it protects us from the frailty of human behavior. So people do not follow health protocols. They forget. They let their guards down, and all of us get compromised because of that. So in parting, I just like to say that in our Filipino style of pandemic management, in the ragtag jeepney that we are all riding in with the contact tracing, testing, vaccination, etc., while traversing the pandemic, the vaccine is actually our seatbelt. It does not prevent the accident, but it will lessen the probability of us dying if ever that accident happens. So thank you very much to everyone and good morning.
Thank you very much, Dr. Legaspi. I'm sure many more of our participants got a higher degree of confidence after listening to your presentation. Our next panelist is a university scientist at the University of the Philippines. She is presently Associate Dean for Research and Public Service and Professor of Microbiology at the College of Arts and Sciences in UP Manila. The study of coronavirus and other viruses is a branch of microbiology. She is a Doctor of Public Health with specialization in medical microbiology and a diplomate of the Philippine Academy of Microbiology. Fellow Rotarians and friends, let's welcome the incoming president of the Rotary Club of Parañaque Metro, Dr. Marilen Balolong.
Thank you very much, Dog Sunny, for that humbling introduction. And of course, thank you very much for this invitation. I might request my cam to be off because I think my internet connectivity is so crazy this morning. I'll just be turning on my camera again later when my connectivity is better. Thank you. So, Rotary International President Holger Knaack, past RI President and TRF Board of Trustees Chair K.R. Ravindran, past RI Director and the National Chairman Guiller Tumangan, former DOH Secretary, Dr. Esperanza Cabral, PGH Director, Direct Gap, Legaspi, past and current district governors and officers, past and current presidents, fellow Rotarians, Rotaractors, participants in the Zoom room, and the streaming live and the YouTube live, a pleasant good morning. I am beyond thankful to the organizers of this highly relevant event for including me and giving me the platform to share my advocacy of vaccine saving lives, as well as science communication and diplomacy as a microbiologist and immunologist, and a non-clinician. For my disclosures, I am not a physician, but I am a scientist. I am not connected with any company manufacturing vaccines or pharmaceutical products for COVID-19. My trainings include vaccine design and evaluation, virology, and immunology. And my sharing for this morning is entitled Serving Science to an Information-Hungry Nation, a diary of a microbiologist during the COVID-19 pandemic. Next slide, please. I arrived in the Philippines last 2018 from my postdoctorate training with high hopes of sharing my science on health and environment research. So before COVID-19, I was studying and utilizing microorganisms to discover treatments for cancer. I was into vaccine design for viruses like rotavirus and porcine epidemic diarrhea virus. And I have a dream to develop an adjunct functional food therapy for HIV patients. As for the environment, I was determined to monitor antimicrobial resistance to help alleviate health concerns linked to it. It was a busy person inside my laboratory. And as a microbiologist, we are always stereotyped as laboratory introverts, never leaving the laboratory until a breakthrough needs to be disseminated to the world. Next slide, please. And like a thief in the night, COVID-19 came. A novel virus locked us up inside our homes. Frontliners close to my heart fell one by one. The promise of a cure seems nowhere in sight, and the confused nation developed fear. Next slide, please. It was opportune time for this microbiologist to go out of the laboratory and talk to people in the way they would and should understand science. In 2020, I was all around talking about the virus, its biology. How different is it from flu? Its origin, why it jumped from bats to humans, how it would spread from one person to the next. I found myself talking with all kinds of people, even kids, as if I was serving meals to satisfy their hunger. Next slide, please. Thanks to science, vaccine development went swift. Drug repurposing research went on to solidarity trials, and new pipelines for drug discovery, including machine learning and even artificial intelligence, were introduced and utilized. Scientists all over the world collaborated, shared their data. This is toward one goal: to end the pandemic. There was the great amazing race, as we call it, for COVID-19 vaccine development. And so by 2021, I was not just talking about vaccines are, I was differentiating the various COVID-19 vaccine candidates. I was encouraging people to be patient and was strongly advocating for everyone to get their jabs when they will be eligible to get it. Next slide, please. Thank you. It is as if planned. The media opened their doors, and because of this, more people were reached. Through time, more questions were thrown and clouded the people's confidence in vaccines. Fake news spread faster than the virus. There was an infodemic. With the help of media placements, we made herd immunity more easy to understand. The interviews gave people the idea of the importance of their role and their responsibility for our country to achieve it and eventually eliminate the virus, if not eradicate it. Next slide, please. When the vaccine rollout started, people, including health workers, yes, health workers as Direct Gap have shown it, were hesitant to get vaccinated. The people have lots of questions. In that way, we must provide the answers. Some of them, when I ask them, will you get the COVID-19 vaccine? And then the answer I get will be, well, it depends on the brand. Last month, I shared a COVID-19 vaccines 101 talk. This is hosted by the Rotary Club of San Pedro South and Rotaract San Pedro All-Star, entitled The Whys and Because of COVID-19 Vaccination. My goal was to address several questions about COVID-19 vaccines and help them choose to get vaccinated when their turn comes. It was attended by almost 200 participants joining the Zoom, the Facebook live streaming. So before my talk, as I usually do it, I asked my participants this question. If you are eligible in getting vaccinated now, will you get your slot for the shot? When I asked that, around 47% said yes. I said, well, it's better than 10% or 20%. And 11% said yes, and the others said no. And 42% were not sure. I started my talk, and then I stayed until all the open forum to answer their further questions. I think my talk was just 15 minutes or so, but the open forum lasted for 2 grueling hours. But it was fun because all their questions were answered. So before I said goodbye, I asked the same question. If you are eligible in getting vaccinated, will you get your slot for the shot? I was surprised that 93% now said yes. No one said no, and only 7% were not sure. So beyond problems of vaccine availability and equity, which may be far beyond our control, there was hesitancy, and this calls for sustained literacy. Next slide, please. So friends, vaccines save lives. You have heard all the wonderful information from Dr. Cabral and Dr. Legaspi a while ago. Threats from various vaccine-preventable diseases like polio, measles, and others have lessened because of vaccines. And as we Rotarians advocate to end polio, maybe also advocate for COVID-19 vaccination, we can end this pandemic together. And as we wait for our turn to be eligible for the vaccine, please wear your mask, distance socially, routinely wash your hands, and keep your immune system healthy. We can overcome. So for those who got their shot, good job. Thank you for helping the Philippines get closer to reaching the target herd immunity. And may this personal sharing this morning somehow help my fellow Rotarians and all the participants who still have doubts and their family to actively have informed decisions and build their confidence to take the currently approved COVID-19 vaccines in the country. Thank you for listening. Good day and keep safe.
Thank you very much, Dr. Len. Now we will start asking the questions that were sent to us, to our panelists. There's an interesting question here from one of the participants. And this is the question. I am now 63 years old. I have a kidney problem. My left kidney functions at 7%, while my right kidney is at 34%. So he is asking, what is the best vaccine that I could take? Would like to request any of our panelists to answer.
Maybe the clinicians, the gap.
I think for patients like them, the protocol that we follow is that they get a clearance from their doctor, this time a nephrologist. But taking it from our experience, I think eventually this patient will be allowed to get the vaccine. But as a matter of protocol, they should get a clearance from their nephrologist.
Okay, thank you. Another question. This is from Patrick Sun of Rotaract, Dasmariñas City. With the vaccines available being given by the government, which one works well with senior citizens? My parents are afraid to be vaccinated because of rumors online that certain vaccines may complicate the prevailing illnesses that they have. So, vaccine for senior citizens.
Yes, maybe I can answer that. There is no vaccine that is going to make whatever comorbidities or prevailing illnesses you have. In fact, the vaccines are important for those who have pre-existing conditions because they are part of the vulnerable population. When it comes to what is the vaccine better for senior citizens, of the two vaccines, Sinovac and AstraZeneca, which we have at present, it was AstraZeneca that was favored for senior citizens, not because there was something wrong with Sinovac, but because the manufacturers had not disclosed data about people over the age of 60. However, in the experience of PGH, the senior doctors there actually insisted that they get Sinovac because that was the available vaccine at the time. And I don't think any of them suffered from taking Sinovac, even though they were above 60. And I think now that they have protected themselves from getting COVID vaccine. So you can take any of either Sinovac or AstraZeneca, even if you are a senior citizen.
Thank you, Dr.
If I may add to that also, some of those seniors who took Sinovac, not only because it is the first available, but some of them are actually scientists who studied the different vaccines, virologists, molecular biologists, who after examining the information available, the data information for the vaccines, they decided to have the Sinovac. They were seniors, 75, 76 years old, and they decided to have it based on science and personal preference now.
Okay, another interesting question here. What explains the change in allowing persons who have fully recovered from COVID to get vaccinated? Does this mean that the natural immunity that they were supposed to have obtained and would last them for 90 days no longer holds?
Sir, can I answer before Doc Cap?
Go ahead.
Okay lang po. Yan. Since the virus is relatively new, and then the interventions are also relatively new, so all of the data that we are gathering from day one until now, no, are being collected. So as I always say in all of my communications, all ng sinasabi ko ngayon is based on the data that are available today. No? So it may happen that tomorrow there's a new information, then we can change. No? And all of those changes naman are not abrupt. No? They are usually decided by a panel of experts, and those decisions are supported with relevant data.
Okay, thank you, Dr. Len. Another question here. Can I take Moderna vaccine after my second dose of Sinovac?
I think the standing guideline to that is there's no mixing of vaccines as of now. So until we get more data in the future, I think the stand now is we don't mix vaccines for now.
Yes, agree with Director.
So that probably answers the related question where it is asked if your first dose was AstraZeneca, but you were scheduled to have your second dose and AstraZeneca vaccines are not available. Instead, what's available is Sinovac. I think that was the dilemma, no? But perhaps Dr. Gap or anyone in the panel could again clarify that.
That's a big question. Well, that is a valid question because you know very well that the AstraZeneca vaccines, they were all supposed to be planned for the 2 doses in the centers that they were given. But given the fact that if we waited for the, if we consider the expiration date when they arrive, which is May 31, they arrive at around mid-March, we will not be able to give the second dose in the prescribed or in the most optimum time, which is after 12 weeks. So the government decided to take, again, all the second dose vaccines already distributed to hospitals so that we can cover more first dose vaccinees in the hope that the second dose will come within the prescribed period of 12 weeks. So we had 3 months. So I think the government is confident that these vaccines will come in 3 months. If they don't come, I don't have the answer to that. I don't know Dr. Cabral or Dr. Balolong. If they don't come, I think by that time we will have information already whether we can give a second dose with another vaccine type.
Dr. Cabral,
I don't have the answer either because as Gap said, there is no data yet available to us on mixing brands. However, there are a few theories that in fact getting a different brand for your second dose may actually improve immunity to COVID-19. But the data is not yet final. So I'm just hoping, because I did get Astra vaccine, that the second dose will arrive before I need it.
Yeah, I agree with both of them. No, of course, in theory, you can always speculate, and then you can start with a few experiments, and then you would say, okay, but still, until we get the recommendation, no, the official recommendation that we could mix, no, kasi they will be basing that on trials as well. So as of today, tong date na to, no mixing.
Okay, if we could divert a bit, this is not directly about vaccines, but still about COVID. Which test would give accurate results or more accurate results? The RT-PCR swabbing in the nose or throat, or the saliva RT-PCR?
Doc Gap or Doc Cabral before I can say.
So there are studies that show that nasopharyngeal and nasal and throat swabs actually will give you the same sensitivity and results. No? But the available global data shows that the sensitivity of on the average of all the data available for saliva tests is 82% on the average. So for now, I think unless, again, more data is available, as a matter of policy, we still would like to get our swabs using either with a throat, nasal, or nasopharyngeal. So I think as more people are using the saliva test, we'll be getting the data more. But as it stands now, the published global average of saliva testing sensitivity is 82%. So if the RT-PCR test gives a higher accuracy than that, then we still prefer RT-PCR through nasopharyngeal testing, swabbing.
And I
Let me
think
just add to that.
Yes,
Yes,
Dr.
ma'am.
Cabral, kayo po.
Yes. Okay. None of these tests for COVID-19 is perfect. Okay. And all of them need to be correlated with the clinical manifestations of the patient. So even if the RT-PCR is negative, if you are showing signs and symptoms that are compatible with COVID-19, you still will have to presume that you have COVID-19. Okay? If you are positive for the RT-PCR test, but you are totally asymptomatic, there are guidelines on what to do here. And that means basically you need to quarantine yourself. And if after a few days you are still not sick, then you have to presume that even if the COVID-19, even if the RT-PCR test was positive, you do not have COVID-19.
Agree. I'm supporting the answer of Dr. Cabral. No? Like any other tests, no, that we are advised or referred to take, it will always be your physician that would know or that would have the best position to analyze for you. So they will know which test, for instance, or test result will be utilized for your management or management of the patient or for recovery, no, para malaman kung nagre-recover ka na and all. So always seek the guidance of your physician.
Okay, thank you. This topic is very popular in Rotarian chat rooms. While waiting for vaccine availability, ivermectin is all over the news. Can one take this ivermectin as a prophylaxis while waiting positive of COVID but was not shown during vaccination?
If I may answer that, I think this has been proven by the experiences we've had with our vaccination. The vaccination per se will not worsen the COVID condition, the COVID infection that you get before or after the vaccination. What is probably what confuses people is that did the vaccination lead to the COVID infection? I think that's one thing that has to be clarified. So vaccinations do not cause COVID infections. The explanation why after even the first or second dose of vaccination the patient gets an infection is because probably the infection has already been brewing or incubating inside the patient's body, and it just manifested days after the vaccination. So as per our experience with our healthcare workers who got sick with COVID after vaccination, there was no additional adverse effect of the vaccination on the course of the COVID infection. So it doesn't worsen it getting the vaccination when you have the infection.
Okay, thank you. There's a question from DG and Noli Garcia. Any update about the blood clot scare on AstraZeneca and Janssen? However small probability there may be.
Maybe the mere fact that Janssen and Astra have been halted in some countries and in vaccination programs, I think we will have to wait for the data, the trend of the data that's coming in. So I think everyone knows that recently the J&J vaccine was halted from being given because of the trend towards the clots developing unusually higher than in the general population. So we'll have to wait for more data on that. But suffice it to say that there was in our own FDA temporarily halted the vaccination of those below 60 years of age when there was a worldwide reports on the possible effect of the vaccine on the formation of blood clots. But I think just recently they already gave their go signal again to resume vaccination of those below 60 with AstraZeneca. So the answer there, I think there's no concrete evidence yet, but we want to proceed on the side of caution, with caution. That's why there are temporarily discontinuation of vaccinations temporarily.
Okay, thank you. A question from past District Governor Nelson Yuchong-Chan. I had flu vaccines last Saturday. Will that help against COVID-19? When shall I take my COVID vaccine to be safe?
No, the flu vaccine will not help reduce your chances of getting COVID-19. The flu vaccine will help reduce your chances of getting flu, but not COVID-19. And as to when to get the COVID-19 after you have gotten another vaccine, just a couple of weeks will do. Actually, you can get them together if you want to, except that if you get a side effect, you will not know whether it is from the flu vaccine or the COVID vaccine.
It will not target other organisms.
Okay, there's a strategic question here. When is the target time we can achieve herd immunity? And relatedly, how is the herd immunity threshold calculated?
Is that a microbiologic question or a public health
Okay.
question?
So probably I'll start and then the two doctors can come in. So usually usually the herd immunity is computed based on the reproduction number of the pathogen or the virus, no. Gaano ba siya kabilis dumami or lumipat, no? For instance, one person I think for SARS-CoV before the variants came, it was about 2 to 3, no. So from one person makakahawa siya ng 2 to 3 people, no? So based on that, mathematically, they would compute that using, say, a highly efficacious vaccine and including this reproduction number in the equation, they will be computing a certain percentage of the population that needs to get vaccinated. And from then, I think the calculation was about 60 to 70%. It's about 65 to 70 million Filipinos, if I'm not mistaken. No? However, when the variants came, the effect of the variants or the mutation tends to hasten or increase the reproduction number. So for instance, from the kanina na 2 to 3, it became about 4 to 5. So na-doble. So imagine, mas mabilis. So if you have a highly efficacious vaccine and a highly transmissible virus, no? So you need more na, no? Kailangan mo na ng mas marami. So imagine if you have a high efficacious vaccine, kailangan mong higher percentage of Filipinos to get vaccinated. Tas umayaw ang isa, dalawa, tatlo, the longer that we will be achieving herd immunity. And I would just like to clarify that achieving herd immunity is not an overnight thing, no? Na like, okay, 1 year, tapos na tayo, herd immunity na. If you would recall, no, like achieving herd immunity, for instance, for measles or for polio, it would take time, no? And usually, no, the government targets for that and roll out no mechanisms or programs for that so that we could achieve herd immunity later. So bakit ba natin kailangan yung herd immunity? Because as we take the picture of the population, there are some of us na hindi talaga pwedeng bakunahan because of either their age or perhaps their health conditions, no? So if we achieve the herd immunity, even if they don't get the vaccination, they will be protected. So yun po yung beauty ng herd immunity.
Okay, thank you. There's a question regarding the specific strains of the coronavirus. Considering there are specific strains and that only one specific strain that a vaccine covers, according to the question, how can one get protection from other strains?
Okay. Currently, for instance, for the vaccination, the vaccine design naman targets not just one point of the virus, no? So it targets multiple sites of the virus. So for instance, you got mutation in certain area, meron ka bang other areas na tatargetin ng iyong immune system and it will still work, no? I think the mutations that are common for all the variants right now is increased transmissibility, mabilis humawa. Although some data would suggest that I think some vaccines parang bumaba yung efficacy for the South African variants, etc. But of course, ang ano pa rin natin kasi dito is magwo-work pa rin yung current design ng mga vaccines per se, as far as the data is concerned, that are available right now.
If I may add also, I think we can compare this to the flu vaccine, eventually every year we will get a booster because the new form comes out. So maybe for the corona vaccine, it will be less than a year because the variants are coming out faster. So in fact, other companies are now starting to look into this booster shots, just like announced by Pfizer in an article that I read this morning. So that we will probably go the way of boosters on a regular basis, just like with the flu vaccine.
Yeah, so we'll know that and confirm that as the data comes along, no? So every virologist now is taking the lens, no, bigger into the variations or the mutations of the viruses. So viruses are naturally mutating, no? Nature nila yan. Once it transfers to another person, there will be a tiny mutation that will be created for the replication cycle. So ang gagawin natin, ang kailangan nating isipin is, so what the adjustments of the interventions to take place.
Okay, thank you. This is a specific question. Can a pregnant or lactating woman get vaccinated? And if so, will the baby get affected?
Yes, let me answer that question. Yes, we do advise pregnant and lactating women to get the vaccine at present. There's enough studies that show that the vaccine is safe even for pregnant and lactating women. And the American College of Obstetrics and Gynecology, as well as the infectious disease societies, both in the United States and in the Philippines, advise the vaccine for pregnant and lactating women.
Okay, if I decide to have the jab or the vaccine this time and completed the 2 doses of whatever is available now, can I be revaccinated, let's say 6 months from now, if another vaccine brand comes? Medyo brand conscious.
Yes, theoretically, you can be revaccinated and you can use a different vaccine. We do that all the time with flu vaccines. From year to year, you can get a flu vaccine from a different manufacturer.
As long as you complete the first set muna of boosters. The same pair.
Okay, this is a question from Ellen Joy Cabahug. Are persons who have a history of allergies in medicines eligible to have what is available? Sensitivity.
Again, yes. Yes, the patients even with allergies are eligible to get the vaccine. You should consult your doctor. The most important precautions would be in those who get really severe allergic reactions, what we call anaphylactic shock. Also, previously, it was said that if you are allergic to polysorbate or polyethylene glycol, which are carriers found in the vaccines, you should not get the vaccine. But now they've actually withdrawn that kind of advice. So if, for example, you got your first shot and you developed a severe allergic reaction to it, then you are told not to get the second shot. But for the first shot, we don't really know whether you are going to get a reaction to it or not. And the only precaution is if you have had a severe allergic reaction to something in the past, then you have to be very careful about that. What do we mean by being careful? That means you have to have certain things in the vicinity of where you get the injection so that if you get that reaction, the people are ready to fight that particular reaction. So they have to have life-saving tools there, like epinephrine. They need to have other things besides that.
If I may add to that, I think generally patients who present with allergic reactions get their vaccines. But depending on how severe historically these reactions are, whether they wait 15 minutes, 30 minutes, or 1 hour. So that's what is determined by the history. That's why it's very important to give an accurate history of your allergy. If I may share, in PGH, we had 2 doctors who had to be given epinephrine because despite their being highly allergic, they were able to get clearance from their allergologist to get the vaccine. And lo and behold, it's a good thing they were in the hospital already. It was a quick turnaround of events with epinephrine. So it's a precaution that should be present everywhere because it could be life-saving. This intervention could be life-saving.
Okay, we're into our last two questions because of our timeline. The first is specific. Can a family of a hospitalized COVID patient sign a waiver to administer ivermectin to the patient?
We are getting that a lot of. We're getting a lot of that now. So my routine answer is that they ask for compassionate use, permit for compassionate use from FDA. FDA gives either personal approval or hospital approval. So unless we have that, we will not allow it. But as a matter of protocol, it's not routinely given or made available in the Philippine General Hospital. But there are reports that there are hospitals already that have been granted by FDA to give ivermectin upon the request of the patients.
Okay, this is a more strategic question. Given the very low risk posed by COVID-19 to those under 30, which constitutes 60% of our population, is it not more pragmatic to vaccinate all those aged over 30 and then allow the economy to open? If we want to vaccinate the youth, wouldn't it be better to focus on vaccinating them against tuberculosis, which is a much greater risk for them?
Okay. You are right. And I think in the prioritization list, that particular consideration is there. That's the reason why after the frontline workers, the next priority are the elderly, particularly those with comorbidities. And the people who are younger and in the working age group are in the later priority list. However, I need to caution you in saying that people less than 30 do not suffer from COVID. They do. And many less than 30 people have actually died from COVID. Not just as much as in the elderly, but they still can get severe and deadly COVID.
Yeah, I agree with that. I think the example of Italy is a clear indicator of that strategy not being too as effective as logic would tell us. No? Italy decided to vaccinate the workers and the younger age group so that people can start moving around. But I think they're feeling the backlash on the fact that the elderly and the vulnerable really swamped their hospital system when they got sick. So I think as of now, the current protocol of prioritization is probably the best, at least for us here in the country.
Okay, this will have to be the last question from past Governor Chito Recto. Are you satisfied with what the government has been doing on COVID with regards to our fight versus COVID-19?
I beg to defer answering that question because I'm from government.
Yeah. I'm also from government, but diplomatically, no? Diplomatically, I really think naman that the government is doing their best, no? Although each one of us may have a variety of standards of how we would define best, no? Of course, theoretically, if I would have a checklist, for instance, do this, merong mga ilan na semplang, no? But I would always look on the brighter side, no? That these are our suggestions. But perhaps it's time also to listen to suggestions, no? Yung mga sa tingin natin ay nag-work, no, sa ibang countries, we can try it, or perhaps we can ask the community level, and then from the grassroots what will work for them, and then pataas, no. There's quite a variety of mga possible gawin, no, but it takes two to tango, no. Hindi naman kailangan government lang na government. May responsibility din po tayo bilang mga citizens sa pandemic na ito, no. So if the government, for instance, issues dapat do it and do it by heart, no. Pag mamask pa nga lang, iba-iba na tayo ng interpretation, no. Merong nakamask na nasa ilong, nasa chin, no. So those simple things, no. If we are doing kumbaga religiously all the things to protect ourselves, to protect our family and community, and still sa tingin natin ay hindi sumusuporta ang government para makaandar tayo dito, then you have the power, no, to rant, no. Pero kung ikaw ay hindi rin marunong magmask, pag-alagala ka din sa gabi or something like that, I think, no, simula po tayo muna sa sarili din natin. Let's help each other. This is a very difficult time, no, not just for the Philippines, and this is global, no. So we can do our share if given the opportunity, and kumbaga malalampasan natin din to later on.
Okay, thank you. Thank you once again to our distinguished panel of resource persons, Dr. Esperanza Cabral, Dr. Gap Legaspi, and Dr. Len Balolong, for sharing with us your valuable time and insights. Surely, our Rotarians and friends have learned so much and have gained greater clarity in understanding how best all of us could work together to beat COVID now. To give us a summary and synthesis of what we have learned today, may I call on our Regional Rotary Foundation Coordinator, who is also the Executive Director of our Philippine Rotary Vaccination Campaign, from the Rotary Club of Marikina, District 3800. Let's welcome past District Governor Virgilio Farcon Jr.
Thank you very much to our Master of Ceremonies and Moderator, past District Governor Sani Coloma. You know, the task given to me is so difficult because I'm just given 5 minutes to do this synthesis of main points discussed and summation. I guess the answer is correct. It's impossible, but let me try my best. National Chairman, past RI Director Guiller, set the tone with his opening statement. He said, because of this coronavirus, the world became one huge neighborhood. This is an opportunity to give life to Paul Harris' vision of a neighborly world. Rotarians will be engaged at different levels of influence, in little acts of kindness, and with one voice to beat COVID-19. He said, and I quote, today's town hall hopefully will lead to an informed decision, a decision that is a commitment to concerted action. May each district governor, past, present, and future, organize his or her team of presidents to be advocates of vaccination for a COVID-free Philippines at the shortest possible time. Together, as people of action, we shall act with a renewed sense of urgency for herd immunity, resiliency, and socio-economic viability. Our RI President, Holger Knaack, gave us a marching directive. He said, as Rotarians, we have an important role to play in the fight against the COVID pandemic. Rotary International is supporting COVAX, and we advocate fair distribution of the vaccines to all nations. As Rotarians, we educate people and help fight and combat vaccine hesitancy. We need to challenge fake news and rumors on social media. Rotarians know that vaccines work. We must continue to advocate for COVID vaccines just like we advocate for polio vaccines to end polio. We need to go back to fellowship, which is important to the family of Rotary. The spirit of caring is important now, and it will help us shape our future. The caring we do now will make our clubs stronger today for our communities. People will remember those who helped them cope and survive. All the caring we do for others will pay off for a stronger Rotary in the future. Let me start with Dr. Esperanza Cabral as our main presenter. She emphasized the importance of vaccines. It will prevent severe diseases and death. It will also prevent symptomatic cases and transmission of diseases. And finally, it will help reopen our economy. With our poor performance at testing, tracing, isolating, and treating, it looks like the only way out of this pandemic is to vaccinate ourselves into herd immunity. She said this emphatically, time is of the essence. We need to build back the trust in the health system by fighting disinformation, by correcting deficiencies, and by giving hope. Vaccination is the key to end this pandemic, and the best vaccine for us is the one available to you when your turn to be vaccinated comes. Until all of us have been vaccinated, Dr. Cabral emphasized that we have to wear face masks and face shield consistently and correctly. Keep your distance, wash and sanitize your hands frequently, and stay away from crowded places. And please stay home unless absolutely necessary. Our first panelist, Dr. Gerardo Legaspi, in his presentation on creating the vaccine nation, he relates his experience as the first ever recipient of the COVID vaccine in the Philippines and his experiences in vaccine delivery as director of the Philippine General Hospital. On January 11 of this year, PGH vaccine deployment team was formed. Initially, 75% of their medical staff accepted the vaccination. This, however, was increased to 83% after a town hall meeting was held. Of those willing to receive the vaccine, initially, 8% was willing to take the Sinovac, but this eventually increased to 12%. On March 1, PGH held its first vaccination at the PGH Garden. This was when he received the first dose of the CoronaVac, hoping that by his example, more of his staff would follow. He was pleasantly surprised that his senior medical staff all decided to accept the vaccine. There was a deluge of vaccinists in the coming days, and by March 22, PGH was able to vaccinate more than 5,000 or 80% of the PGH staff. It was a feeling of personal self-achievement to be able to protect his mentors and the staff. The question most commonly asked in the town hall meetings is, what is the best vaccine? The answer he suggests is the one we will get, which we get in our arms. On vaccine efficacy and effectivity, there is a large difference among the different vaccines. We cannot simply compare apple to apple. On effectivity, it is best to wait for more data from the field and let the experts decide. But we have to get the ones available now. In a sense, vaccines are our seatbelts. It lessens the possibility of us dying. Dr. Marilen Balolong, a microbiologist, has to go out from the confines of her laboratory to the COVID information-hungry world, talk to the people, explaining how the virus is contracted, the difference between PCR and rapid antibody tests, about the virus itself and its transmission to people, both young and adults. Scientists all over the world collaborated, shared their data, and helped develop the vaccine. When the vaccines came, people, including health workers, were hesitant to get vaccinated. However, through webinars, she needed to allay the fear of the people about getting the vaccine, why they should get the vaccine, and how the vaccines work. There is no doubt that the country has problems of vaccine availability and distribution and equity. But should the vaccines become available, this webinar is here to assure the people that the vaccines, whatever become available first, will save lives. First your own, and then the people that surround you. As we Rotarians advocate to end polio, perhaps we can also advocate to end the COVID. The open forum was very spirited and provided the much needed clarifications and answers given diplomatically in some point, and even gave us concrete examples or answers to difficult questions and specific models on vaccine information campaign and COVID prevention measures, and on how we can go about this initiative. We even had a bonus because there were also questions about ivermectin, which proved to be useful for most of us, or some of us. The use of this drug right now should be under medical guidance of doctors, and as announced by Dr. Legaspi, some hospitals are allowing the use of the drug upon medical advice and request of the patient. We thank all of our speakers and of course our moderator and all Rotarians who participated in the open forum. In closing, let me borrow the words of President Holger when he said, polio vaccination started in the Philippines in 1979. Today, you are making history with this great effort on the Rotary Philippines vaccination campaign. The initiative will help the Philippines emerge from the pandemic faster and will shine a bright light in the work of Rotary. Together, we will bring hope to the less fortunate and will demonstrate that Rotary opens opportunities. Finally, we have to walk our talk, and our national chairman, past RI Director Guiller Tumangan, has led us by example by having himself and spouse Letty to be vaccinated 3 days ago. Yesterday, I'm also happy to announce that I was also vaccinated together with my spouse, Seni. You don't have to wait for the best vaccines. As mentioned by Dr. Cabral, Dr. Legaspi, and Dr. Balolong, the best vaccine is the one available when your time to be vaccinated comes. A pleasant morning to everybody.
Thank you very much, Governor June. Past RI President Ravindran sends his profuse apologies. He was able to find the opportunity to join us quite late, and he tried his best to come in. I think he spent about an hour, but due to some technical difficulties, he wasn't able to join. And he hopes to be able to join us at the next opportune time. So we proceed with our program. The main thrust of our Philippine Rotary Vaccination campaign is communication. We need to create awareness through effective messages and images on the absolute imperative to beat COVID now through massive immunization of all adult Filipinos within the shortest possible time frame. To present to us the initial posters and slogans that we shall use in our campaign is our Regional Public Image Coordinator for Zone 10A from the Rotary Club of Downtown Batangas City. Let's welcome past District Governor Reynaldo Ray Castillo.
Fellow Rotarians, ladies and gentlemen, good morning. Today, we will also launch our vaccination advocacy messages that we hope will be embraced by all Rotarians, and more importantly, disseminated quickly as we are running against time and against misinformation in this COVID-19 battle. We are doing this advocacy in 3 phases, hoping we can make a dent in reversing the low acceptability for the COVID-19 vaccination program. And so to kick off our program, allow me to unveil our banner poster. Beat COVID, get vaccine now. We cannot overemphasize the need to enlist 70% of our populations in the vaccination program. We challenge every Rotarian to help in spreading the word. starting from within your Rotary family to the communities we serve. And to make our campaign visible in social media, we urge you to use our hashtag #BeatCovidNow in your post. With social media as the most popular platform for advocacy, we created a Facebook profile picture frame. At the end of the day, we hope to see thousands of Rotarians waging this battle in social media by a mere flick of their fingers. We also have similar frame without the Rotary logo that you can share with non-Rotarian family and friends. Cliche it may seem, getting vaccinated is indeed a heroic act because it goes beyond self-preservation. It is an act that will help save you, your family, our frontliners, our communities. So be a hero. Get vaccinated. Part of our phase 1 is the launch of several advocacy messages that targets a varied set of audience, and you may use any of these in your locality. You may opt to post these messages in your social media pages, printed in t-shirt, billboards, and others. For this particular slogan, sa bakuna, protektado ka, we will be rolling out blank designs as well, so you can replace the picture used with your own captured photos of Rotarians and other influencers that you feel might work well for the campaign in your locality. This is the same slogan in a different format that can be used as arm or bumper stickers for distribution among Rotarians and other public utility vehicles like tricycles, jeepneys, and buses. May bukas sa bakuna. This particular design amplifies how getting vaccinated will ensure your family's safety and welfare. Please reproduce this message and post it in your local health centers, public markets, barangay halls, and even private establishment. Gusto mo maging in, get that vaccine. In our parlance, being in means belongingness, and we hope to send that message across that getting vaccinated will elevate you to that circle of heroes that care for their family and community. These two comes also in two different designs. This slogan brings the same message as the previous one, with a fancier look that is intended for millennials and the like. This will also look good in social media pages, t-shirts, and other platforms. In all of these designs, we encourage you to add your club's name, but we discourage you from altering any portion of it. Thank you, and let's start being heroes by helping this campaign. Magandang umaga po sa inyong lahat.
Thank you, Governor Ray. I am sure our Rotarians are eager to get going in using the catchy posters and slogans crafted by our Rotary Public Image team. For those whose questions had not been answered, we will try our best to have them answered and relay the answers to you. For the closing statement, let us listen to the chairman of the Philippine College of Rotary Governors from the Rotary Club of Metro Bacolod, District 3850, past District Governor Joje Jude Doctora.
Well, thank you very much, past District Governor Sunny, and good morning to all distinguished dignitaries and guests and to all Rotarians. Magandang umaga po sa inyong lahat. Thank you, Rotary International President Holger, for gracing this town hall meeting. And let me echo what you said about the special relationship of the Philippine Rotarians with vaccination programs. In 1979, Philippine Rotary, through Rotary International and the Rotary Foundation, vaccinated about 6 million children in the Philippines. And this became the inspiration for Rotary International to launch our signature Polio Plus program. Rotary promised the world that we would take out polio from the face of the earth. And today, Rotary International believes that we have another opportunity to be part of a solution to this pandemic. The COVID-19 that has taken lives of people we know and their loved ones, has brought the economies of many countries down, and has changed the way we live. We may not be giving out COVID-19 vaccines, but Rotary International directs us to be the forefront and become frontliners to the campaign, to let people know that the solution to this pandemic is vaccination. Past Rotary International Director Guiller is one of the early responders to this call by RI. He immediately convened the core leaders of the Philippine Rotary, and in less than a month, we were able to organize this very successful town hall meeting. Thank you, Director Guiller, and to all the core conveners. Of course, we thank and truly appreciate our three special guests today, who are indeed experts in their field. Thank you, Dr. Cabral, for highlighting the proof of the good that vaccines do, and for debunking the many myths about COVID-19 vaccines. It's sad, though, to note that only 60% are willing to be vaccinated. Thank you also, Dr. Legaspi, for taking the first step and in organizing the UPPCH to lead the way. I'm sure it has brought confidence and acceptance to this vaccination program. And thank you also for bringing the frailty of human behavior in the equation of vaccination campaign. And of course, we would like also to thank Dr. Balolong for sharing your diary as a microbiologist in this pandemic and for providing the science about COVID-19. And you also inform us that by sharing information, the correct information, there's a possibility of changing the way people look at the vaccination. It will change vaccine hesitancy to vaccine acceptance. We truly hope that with your expert opinions, we can overcome the vaccine hesitancy, the fake and conflicting information that abounds around us every day. Our goal for this town hall is for this to be a clarion call. Sorry, I think, is my audio still okay?
Yes.
Yes. Audio. Okay, sorry. Okay. Our goal for this town hall is for this to be a clarion call for Rotarians and non-Rotarians alike to snowball this vaccination campaign until our country attains herd immunity. The road ahead is paved with many challenges, but we Rotarians will not be discouraged. After all, we open opportunities, and service above self is our motto. Thank you to all the participants. Let me remind you, if you want to be a hero, get vaccinated. Kung gusto mo maging in, get vaccinated. Mabuhay ang Rotary, mabuhay ang Pilipinas. Maraming salamat po. Let's beat COVID-19 now. Thank you very much.
Thank you, Governor Jude. I have an important announcement for all our participants. We shall have a picture taking of our Zoom meeting, so please stay on. As I now call on our national chairman to formally adjourn our virtual town hall. Let's welcome back past Rotary International Director Guiller Tumangan.
Again, thank you to all our resource person. And speaking of past RA President Ravi, he tried to enter for almost 58 minutes and calling me up every 5 minutes on how to enter. He really wanted to share with us and to talk to us. And a big, big thank you to all participants. And now, as National Chairman, with much pleasure, I now adjourn this fruitful town hall.
Okay, thank you, Director Guiller. Please stay on to your seats while our official photographer takes our souvenir photo. Governor June, please direct.
Okay, kindly turn on your video, please.
Everybody,
Everybody.
turn off the video.
Turn on your video. Okay, for the first page. Okay, wait. Okay, first page. You don't know what page?
Stop, June. Hindi ako payagang makapasok eh. Please. Yeah.
Turn on mo lang yung video mo.
Hindi natanggapin eh.
Nakalagay po ay
You can't start your video because the host has stopped it.
Pwede mong...
Pwede na ngayon, Governor.
Pwede na.
Pwede na.
Ayaw pa rin eh. Anyway.
May pakiclick nga yung ano.
Galit yata sa akin yung host. Wala. Sige na.
Okay, page 1.
Okay, page 1. Page 2.
Dali mo siya sa page 3.
Actually, we're just taking the pictures of the panelists and the guests.
Ayan na. Okay na.
Balikan natin si Ray. One ulit. 1. Okay, page 2.
Smile.
Okay. Okay, hanggang page 2 lang.
Thank you. Congratulations. Guiller and all the convener. Congratulations.
Congratulations, everyone. Great job, congratulations, PDG Sunny, for wonderfully navigating this town hall, no?
Thank you very much again for everything.
Congratulations.
Thank you. Thank you for inviting us.
For following up our speakers. Governor Chacha.
Thank you, Doctora.
COVID now.
Thank you very
God bless
much.
us all and God bless our country.
Amen.
Thank you.
Thank you to Dr. Len.
Thank you.
Galing.
Thank you kay Doktora Cabral.
Our doctors.
God, Doktora Len.
Thank you, everyone. Thank you.
Ate Marilen,
Thank you, Derek.
Sa ulitin po.
Yung ating follow through, di ba? Kailangan may follow through. Salamat.
Bye-bye.
Bye.
Bye po.
Hi, Rich. Governor Rich.
Direk. Congrats, Gov Sunny. Thank you.
Ana.
Yes. Yes.
Thank you, Director there.
Congratulations.
Thank you to everybody. Hi. Joyce. Okay, George. Joyce. DG Joyce.
Congratulations, Guiller. Congrats, everyone.
Joyce, thank you.
Congrats.
Thank you po.
Happy lunch. Happy lunch lahat. Happy lunch.
Happy lunch. Ayuda.
Lulu. Sunny.
Yung ayuda, papadala na lang natin. Yung ayuda, papadala.
Sa speaker.
Hopefully, tonight or tomorrow lunch.
Okay. Good.
It's a bad bowl Mongolian combination.
Meron din kami niyan. Abot ba yan dito, Gov June?
Convenor.
Hanggang abot lang ng kamay ko.
Virtual lang kami.
Virtual bad